Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. This is Caroline. I am a family nurse practitioner here at Fiat Integrative Health, and today I'm joined with Dr. Ed Glynn.
Hey, good to see you again, Caroline.
Good morning. How are you doing today?
Great.
Awesome.
It's almost spring. Actually, I'm claiming it now. Spring has arrived early this year.
It is supposed to be like 75 tomorrow, and I cannot wait. It's going to be amazing. My kids are going to be like, can we break out our swimsuits?
Exactly.
Okay, great. Well, we're going to dive into today's topic. We are going to talk about adult health, which I can't say it's my favorite topic, but I'm really excited because it's Dr. Ed's favorite topic.
Absolutely.
So first, I would love to hear from you, like, why should people come in at all to the office? Because I think that a lot of adults, I know I've seen adult patients who are like, I haven't been to the doctor in 10 years, 20 years. And like, what's the point? Like, why even come in? Why have a physician if I feel great? So yeah, I'd love for you to enlighten us on what you think.
Sure. And in fact, my own thinking has transformed in this area.
Mm-hmm.
When I was trained and where I practiced in a large, very industrial-sized medical complex, annual exams were discouraged for adults. But if you actually step back and look at what we know is kind of the natural evolution of exams, it begs the question of why we stop them as adults. When a woman is pregnant, we know that there is decrease in infant mortality and decrease in preterm births when there is prenatal care. So what do? We dive deep into prenatal exams, and it's not annual, it's weekly and then monthly, and every aspect of that pregnancy is monitored. And then we have a baby, and then the baby is sent to their checkups. And why do we do that? We look at every milestone, we look at every aspect of this child as they're developing, and we see the importance of intervention and identification and optimization and creating that relationship with the family. And then after they turn 18 and they go to college, they only come and see us when they're sick. And then they come back when they're older and they have 7 chronic diseases. And we wonder, why is it important to do an annual exam? And in fact, I was trained that annual exams, even the U.S. Preventative Task Force, that became kind of the Bible of medicine, doesn't recommend them. And I realized a lot of that was geared toward the rationing of healthcare, as well as the purpose of going to a doctor. Why do you go to a doctor? Well, you went to a doctor only if you need a medication. You went to the doctor because your bone was broken or you were going to give it a prescription. It was not about the discussion. It wasn't about optimization. It wasn't about creating a relationship. It was about a transaction. And so if it's about a transaction, then going and getting blood tests and having a discussion about optimizing your health really wasn't in the favor of occupying that private time with a doctor that could be utilized to generate revenue in a different way. And it also wasn't a good expenditure of a population-based insurance policy. But if you step back and look at what we do from the life cycle of these annual exams with pregnancy and childhood, did any adults get annual exams? Well, yes, pilots get them. Why? Because they want to make sure that pilots are safe in the sky, and truck drivers have to get an annual exam. We want to make sure our streets are safe, right? Well, who else? Well, executives get an exam. Why? Because we want to make sure this company is led by someone who's healthy and is going to be here a long while. And yet we all are CEOs of our own households and our own smaller businesses. And in fact, with smaller businesses and private businesses, when everything really depends on a very small number of individuals, don't you think it would be important to have an annual exam to make sure that not only that everything's ticking well, but that it's optimized. And so that's when I started to transform my thoughts around the annual exam and realize that this is now not simply something that's done for certain individuals. This is more of like the inheritance. We now get to inherit all this very scientific work that's been done by our colleagues in labs and in hospitals to look for every aspect of the metabolic changes in our body, to identify early onset of diseases and perhaps even catch cancers before they cause chaos in the body. All of that is the inheritance we have. And in 2026, we can fully take advantage of those things like never before.
Yeah, it's so interesting because it's like, we've heard this before, that healthcare has become sick care. Like you're saying, you only go in because you're sick and I have a problem. And, we here, our philosophy, I'm sure we'll talk more about, is really more so like, how can we not catch it in the ER? How can we not catch your high blood pressure in the ER? And I know, like, you've seen patients. I love to hear any examples that you've had of like, wow, it's a good thing you were here today. It's a good thing we're catching this now. Even in my own health, like, I just drew labs for myself. I'm 7 weeks postpartum now. And I've never done that before. I've pretty much always operated under the same mindset of like, I feel fine and I go to the OB. I've now had 7 kids. So I feel like I'm at the doctor a lot.
Exactly.
But there were things in there that I was like, wow, there's some things in here that need real work that I wouldn't have known about. And it's changing the way that I'm living day to day so that I don't end up with non-alcoholic fatty liver, let's say, or high blood pressure or anything like that. So this real new preventative and, like you say, optimization, like, can we not just get good enough? We had someone recently I was talking to who had an annual exam at, St. Thomas or wherever, some normal place. And they were just so disappointed because it was like, here's your labs and everything's fine. And I look at their labs and I'm like, well, everything's not great. Like, it could be better.
Exactly.
There's things that you could be doing to make this lab work even better. And the fact that the doctor was basically like, well, you don't need a statin, so like everything's therefore fine.
Yes.
Like, so are we just going to wait till he needs a statin?
Precisely.
And then we're going to intervene? Like, that just feels so wrong this day and age.
Right.
And so, anyways.
Yeah, and you're right. It's a difference in philosophy. If the philosophy is, I'm looking for broken things because I have a fix, it's called my prescription pad, or it's called my surgery, or it's called an intervention, that's what I'm going to look for. But if it's about, and this takes more time, if it's about having to talk about lifestyle and maybe changing habits, or how about preventative, all of that gets fluffy because you have to talk to people and you have to create a relationship and you have to create the motivation through this discussion. But actually, that's the whole purpose of the annual exam. If you step back, the annual exam is not to find broken parts. It's to identify what you're doing well and measure objectively to see that truly we can objectively prove that you're doing it well. And then to look at a number of other areas that now we can do, and it's very cost effective, to look at whether it's metabolic processes or actually looking at calcium scores of the heart, and looking at what perhaps already is developing in your body, but you're not seeing it as a symptom. And the real purpose of this is to find areas that you will be motivated to make improvements and enhancements in. It's not about finding what's broken, but it's about finding what you could optimize to actually live better. I go back and I think about, from a biblical standpoint, in Corinthians chapter 6, which is full of wonderful things, but specifically 19 and 20, our bodies are the temple of the Holy Spirit, and we're to honor God with our bodies. This isn't about seeking the fountain of youth. It's not about holding on with our claws to life so that once life is slowly disappearing from our hands, that's the end. No,
right.
This is about taking care of what we've been given,
right,
and optimizing what we can. Trust me, even when we do this and we do every test and we optimize everything, life will still have suffering for us to endure and offer up. It's no need for us to actually encourage that suffering with things that we could perhaps prevent or even optimize in our life. So that's really the purpose of these.
Yeah, just good stewardship.
Yes.
Over our bodies. I think it's imperative. And I think there is a fine line because I definitely see in the health community, you've got basically two ends of the spectrum and virtue is always found in the middle. And the one end is basically like, I don't care about my body at all. And I'm driving through McDonald's every day, or whatever, not exercising, not paying attention and just letting it be what it is. And then the other end of the spectrum is that chasing the fountain of youth, right?
Yes, exactly.
I'm going to live forever and I'm so afraid of aging, of illness. And yeah, we fall right in the middle of like, how can we steward our bodies well with the technology we've been given? I think that's absolutely totally responsible of us. And I think that there's so much that we can do now. And I'd love for you to touch on that. Even maybe start at the most basic level of an example of a patient that like we did our basic run through with and kind of some things that we found, some real concrete examples of little things that we tweaked. And then even more, some of the things that now we can do that we offer that are new and exciting. I would just love to hear that.
Sure. I kind of look at things in threes because it's easier for us to remember those. So I think of like level one is your basic, here's the gold standards, here's the basic things that we could look at. Your blood pressures, the cancer screenings that we know are very easy to catch, whether it's breast cancer or colon cancer or cervical cancer. You look at your vital signs. We can look at our BMI and we can look at our blood pressure and identify things. And it's interesting to see how often blood pressure is a key area. Higher blood pressure is associated with shortened lifespans. It's associated with a lot of morbidity, which is I translate into suffering that perhaps could be prevented. And high blood pressure usually starts about 10 years before it's actually treated. So actually monitoring for that and finding that and identifying it, it's rare that I find an individual who has an emergent level of blood pressure, but it's quite often that we identify people with high blood pressure here that didn't have that awareness. But then when you talk about it, oh yeah, mom and dad had that and my grandfather had that. That's quite common. But also even in the gold standard, and the gold standard for Fiat is different than the gold standard for your average primary care.
Right.
So when we look at on an annual exam, we do a rather in-depth view of what we would consider the basics. And it's very often that we identify a vitamin D level that's almost unmeasurable.
Yeah.
And there are vitamin D receptors in almost every cell of our body. It's not just about skin. It's not just about eyes. And it's not just about mental health. It's about every aspect of it.
Yeah.
And also involves testosterone, which we will get to at the end. So there are many times when we pick up on this first level significant areas that normally in another practice would be never monitored or never measured.
Yeah, and I figure like that's low-hanging fruit, as I call it.
Absolutely.
And a lot of people who are resistant or just, financially, I totally understand. Like doing lots of labs and all these things are really fun and exciting, but they cost money. And so, I'm always like, let's just do our basics,
Yes.
which could show some significant things like your thyroid, anemia, some basic things that can be worked on that could totally help your symptoms potentially, lipids, all of that. So yeah, absolutely. That is to me low-hanging fruit and what we would say is the basics.
Absolutely. Then you get to this next level, which gets to be exciting. This is the kind of more the evidence-informed integrations. So this moves from your gold standards into there is evidence that it matters, these areas. So this is where you begin to look at deeper dives into truly what is my cardiac calcium score? What is that? That's an actual evaluation of plaque that's already developed, which is asymptomatic. You wouldn't do this if you were actually symptomatic and having chest pain or can't climb a flight of stairs. But it is very informative. And to be honest, it's probably the most motivational study I've found on many of my patients when they actually say, wow, I actually am already beginning to have this. And so that's another area. This is where we also see the GI mapping. And these are areas where we know there is evidence on this. And around the leaky gut and identification of that. And these are areas that, while they're not, quote unquote, cutting edge, They are in the newer boundaries of healthcare.
Yeah.
And these are areas where you will not get that intradimensional medicine. This is where you really start to enter into that integrative area. And there's other ones like the Dutch testing for hormones and whatnot. That's that second level. And then you actually have the third level. And I look at this as more like the pioneering labs. This is where you're looking at like the MTHRF genes, and this is where you're also starting to look at the cancer screening tests like GRAIL or Cologuard's new one that they're coming out with, and evidence. Yes, there is evidence there, but these are the cutting edges,
right?
And there are times for that. And maybe this is not something you do on an annual time. Maybe this is something you do every 5 years. This is not to say this is like a splurge, like a Sunday after dinner. This is more like a splurge, like a new set of tires for your car, because you don't need those every time you go fill up the gas, but you probably need them every 30 to 50,000 miles. So that's where you would start to have this type. And it's important at that level to have someone to journey that with you.
Yeah, absolutely. And I find a lot of these tests are useful, especially when we've kind of done that first round of, all right, let's do some basics, basic lab work. And we don't find anything, let's say, or very little, where it's like, that's probably not the contributing factor, right? Your low vitamin D may be part of this picture, but it's probably not everything. And we still have more questions and we want to dig deeper. And I feel like at that point, a lot of times in a traditional primary care office, you get shipped off to a specialist, right? It's like, oh, you're still having GI pain? I guess you have to go see a GI doctor who's probably going to give you Miralax.
Yes. And send you back.
Yeah, and send you back, exactly. And come back in 6 months or, and obviously there are plenty of times that we refer to specialists and is absolutely warranted. But there are also many times that we can avoid a specialist, and we try and dig as much as we can. And so it's definitely, I know I will use, for instance, the GI map, and I'll say, there's some evidence with this, but it's not the same level as blood work that is run-of-the-mill gold
CDC
standard.
And the complete metabolic panel.
But let's try it. Let's see what we can find. Let's see if there's some dysbiosis. And if we address that, maybe this issue will go away. And I had a patient recently I know I was telling you about who had seen dermatology for a year for her perioral dermatitis and just wasn't happy because they just kept throwing more drugs at it and they weren't working. And so I said, okay, well, we've done the basics. Let's go ahead and move into a GI map. We did a GI map, and within 2 weeks of being on that protocol, her perioral dermatitis resolved. It's like, clearly this was not just a skin issue. There was so much more going on here. And so that's kind of the partnership that, comes with the clinic that we're running here at Fiat and our philosophy. And I think too, I'd love to hear from you because you've only been here for a short time now. But for me, the relationship that's built has been just so fun to see and just a real privilege that families come to you with things that, my kid didn't get into the high school they wanted to. And they're reaching out to tell us that or like, hey, you had a baby, I want to bring you a meal. Like, it's just so special to really partner with families to, their whole health and wellness. They clearly know it's not just about we're going to get you in and out and it's going to be quick, and we're just looking at your physical health and that's it. Like, we're really here to partner with people. So I'd love if you have any experience with that.
Yeah. And I mean, it's one of the main reasons, maybe it is the main reason I'm back here. I went into medicine to be a family physician because of that relationship.
Yeah.
Being the first in my family, I also had $300,000 in loans to achieve that dream and worked in rural medicine and had to work those off. And then with a large and growing family, I moved out of that individual care to care at a director level and at a VP level and then at a chief level. And then I realized I was so far away from what I first got into healthcare for. And that was the individual relationships. We are humans. And by definition, we are social and creatures of God. And that social aspect is not just a means to an end. It's not just, I want to talk with you because I need something from you. It is the relationship and the energy between two individuals that actually brings us up to have the realization that we are more than physical. We have this spiritual aspect to us, our souls. And how do the souls connect? It is this one-on-one or unit to unit, I should say, like family to family relationship. And that's I think the focal point of Fiat, right?
Right.
Fiat is where Mary said yes to God, conceiving in her womb, which is the growth of that family. And I think that family unit is a key aspect here at Fiat. And I craved that.
Mm-hmm. It's so fun. I love it. It's one of those things that I think people don't realize. Like, if you haven't experienced it, you don't know what you got till it's gone, kind of thing. Like,
yes, absolutely.
If you go to a normal doctor, it's like, oh, why would I pay outside of insurance? It's like, you just don't realize the difference, and once you do, for many people, it's worth it. I'm not saying everybody, necessarily, but for a lot of people seeking out that partnership, like, we're here for it. We love it. That's people text me, I don't want to bother you. I'm like, that's why I'm here,
Yes.
Okay, great. So can you explain to me, well, let me preface this question with, many people on our patient feedback survey over the last 2 years have said, please get a male doctor, because we had all female nurse practitioners for a while. And I was like, I hear you. Trust me. Like, I want nothing more than a male doctor. I love all those men out there, but I also know that men like to see men just like women like to see women. And, you're naturally more invested in your own sex's, let's say, care, and so it's not that I don't love caring for men, but I think that you probably love it more, and you're more invested in it. And so tell me maybe a little bit about the difference of that male and female annual exam and how they differ.
Sure. And, we can look at by evidence that there is definitively a difference. I mean, we just look at lifespans. Women live longer than men. It's roughly 76 and 80 to 81. Men die at roughly 76 and women at 81. But it's also true that women live with about 2.5 years more of a chronic disease than men do. So even though they're living longer, they're suffering longer as well in that aspect. And in both areas, that annual exam, I believe, can play a very pertinent part. Because why do men die? Well, if they're living to 76, they're dying from coronary artery disease, or they're dying of a cancer that could have been prevented, usually colon and prostate. And women as well, they're also passing away, but they're having these chronic diseases. And what are those chronic diseases? Many times it's dementia. And now dementia, in many aspects, we're looking at it as coming from insulin resistance that perhaps could have been caught, not perhaps, definitively could have been caught decades before.
Absolutely.
So this annual exam affects men and women, but it does differently. Just by the age, we can see that. And by the way, we share the same hormones, but in completely different ratios.
What?
And those hormones in different ratios make us, in many ways, the unique characters that we are as male and female. And so looking deeper into that, men shy away from doctors much more than women. In fact, 30+% fewer clinician visits. And not only 30% fewer clinician visits, that's just for any visits. For annual visits, it's much higher than that they shy away from. In fact, north of 90% the annual exams that I do get are scheduled and produced by the wives in these men's lives. That's why they are here.
I just have to say, I had one patient who I'm going through their history, which is filled out when you enroll. You fill out your history. And I'm like, okay, I see that you snore. And the man's like, no, I don't. I was like, did you fill this out? Clearly your wife did. He's like, oh yeah, she did.
Exactly.
And I'm questioning which one's more accurate,
Exactly. So the gentlemen don't come in as quite as often, not quite as nearly as often as women do. And what is there to offer? Well, now what's the big trend right now is the big T, right? Yeah. Testosterone therapy. And I need to get my testosterone checked. Well, there's much more than just testosterone, but testosterone is a key aspect of it. And it's not just testosterone, right? Yeah. There's a whole evaluation of hormones for men that we can evaluate. But what's the end point, right? Why, doc? I don't want to take shots, and I'm not interested in that's not what it's about. Yeah. It's a sign that there's an imbalance in your life. And there's so many aspects that truly affect that testosterone. I mean, I'll start from the very basics. Vitamin D has a huge impact on testosterone. Right. But there's sleep, there's weight-bearing exercises, there's a whole litany of ways to approach and abnormal testosterone. And in fact, in 2026, 25% of men at the age of 30 and above have a low testosterone. It's abnormal. It is not normal to have that. And why is it? There's so many different aspects of why that is. And that's what we would dive into. It's not you're not coming here because it's broke. You're coming here because something is off. And whether it's a low mood, feeling down, not having the same motivation, not having the same drive. It's not just about sexual drive, but it's also drive on, hey, the weekend's coming up. What are we going to do? I just don't feel like doing anything. These are key signs now that are coming. Brain fog. These are key signs of a low testosterone that can be addressed and should be addressed.
Right. Yeah. It's like for women, we always say your cycle's your fifth vital sign.
Yes, exactly.
It's not just like affecting your quality of life.
Right.
It's a huge signal. So absolutely, I totally agree. And we're definitely not, as some people seek after that, well, I just want testosterone. And we actually are like, well, we're not just going to do that.
Yes.
Like the two ends of the spectrum. I never want it. Okay, well, sometimes it's appropriate. And then the other end of that's all I want. It's like, well, no, we can't do that either. That's not good for your body to just Band-Aid it. We're really going to dig deeper. Awesome. Well, what else do you want to add, Dr. M?
So, I think in summary, we've listened to our patients and they've asked us for things, right? They've asked us for diving deeper into aspects and on annual exams, wanting more. And so we're going to start creating those different levels. Right now, we have a very basic but much deeper than what you would expect at a normal clinician's office for your annual exam. But we're going to offer that with now some added possibilities if you'd like to dive deeper into your annual. But it's still that soup to nuts level. But maybe every couple of years, maybe every 3 years, you want to really dive and you want to do some more of that more functional-based evaluations. Maybe you want to do a deeper dive into your coronary calcium score, or maybe get a DEXA scan to look at your body makeup. That would be our second level. And then that third level is truly when we're looking at those advanced horizons. And there are people that this is a key aspect. It's a time for them in their life that they want to do this. Maybe it's every 5 years that they want to actually take a true deeper dive into some aspects. This is where we would start to scan your entire body for cancers and maybe actually even doing full body scans. That's that third level. It's much more a la carte, and we have a great discussion about that. But we've listened to you, and that's what we're going to start offering. So you're going to see these pop up on our that would be the first place to go is fiathealth.org.
Yeah, that's right.
And that's where these will be listed. And that'll be also available for individuals. Maybe it's a brother or an uncle or a friend in the neighborhood that, they're not ready to join Fiat Health for a membership, but they would like to have this annual exam or this once every 5-year exam where they come in and we do this. That will be made available to them.
Yeah, we can do a deep dive. And we offer that now for women specifically because we have our women's health where they do a real deep dive into hormones. And not to say that, we know men and women's hormones are different, but clearly women are more complicated. In my
Caroline
opinion.
just said that. I did not. That did not come from me.
But, they really specialize at deep diving in hormones for women's and cycles and infertility and all of that. But yeah, we're excited to start offering it. For men especially who want that deep dive and more testing. I mean, it's just exciting, honestly, an exciting time in the medical field.
It really is. No longer is this now for just the rich and famous. No longer is it just for the pilots and the truck drivers. Now everyone should take part in this inheritance that we have of all this technology that allows us to dive deeper and really take responsibility for this temple that we have.
Yeah, absolutely. Well, it's been a real pleasure, Dr. Ed.
Thank you. It's always a pleasure.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.